Okay, so you know how we all have those kind of awkward childhood memories of going to the dentist? Like the smell of latex, the sound of the drill, or maybe even having to get braces?
Ugh.
It makes me cringe just thinking about it.
Oh, yeah, I can definitely relate to that.
But those experiences got me thinking, what actually is the difference between a dentist and an orthodontist?
Yeah, I've wondered that myself.
So that's exactly what we're diving into today, especially since, we're kind of stuck with these teeth for life.
That's for sure.
And to help us out, we're taking a deep dive into this article I found called Orthodontist Vs Dentist. What's the difference?
Sounds interesting.
Right. So the article starts off by basically saying what we already know. Both professions care about our oral health.
Makes sense.
But then, bam, curveball. It says all orthodontists are dentists, but not all dentists are orthodontists.
Oh, wow. Really? I never knew that.
Me neither. It's kind of like how every square is a rectangle, but not every rectangle is a square,
Yeah, that's a good way to put it.
So, of course, I had no more. So the article goes on to say that both dentists and orthodontists actually start their journey down the same path.
Huh.
So think about it. 4 years of undergrad, followed by the, infamous dental admissions test, the DAT. Anyone else get, chills just hearing that acronym?
Oh, yeah. So nerve-wracking.
Right. And if you manage to survive that beast, then it's another 4 grueling years of dental school. Dissecting teeth instead of frogs this time.
Oh.
And then finally, there's I don't even know what to call it, the mother of all exams, the National Board Dental Examination, or NBDE for short.
Intense.
It's an understatement.
It's actually really interesting when you compare it to other medical specialties. Like, you wouldn't want a general practitioner performing brain surgery, right?
Or not.
It really highlights how important dentists and orthodontists are to our overall health. We're literally trusting them with something that we use every single day. To eat, to speak, even to breathe.
You're so right. I've never thought about it like that.
Yeah.
So we've established that dentists and orthodontists go through some seriously intense training. But here's where the road kind of diverges. Our article explains that after dental school, orthodontists still aren't done. They actually go on to complete an additional 2 to 3 years of specialized residency.
Wow, that's a serious commitment.
Tell me about it. We're talking about mastering everything from, putting on braces to using some really high-tech techniques. And then, as if that wasn't enough.
There's more.
Oh, yeah. They still have to go and pass another exam, the ABO, to become board-certified orthodontists.
Oh, I'm tired just hearing about all that.
Right.
Well, it makes sense when you think about it, right? It's like you wouldn't see a heart surgeon for a sprained ankle, would you?
Definitely not.
Orthodontists develop this really specific, specialized knowledge all about facial growth and jaw alignment, and how to fix those really complex issues, too.
So they're basically the specialists you need if you want a healthy and functional bite.
Exactly.
That makes total sense.
Yeah.
Okay, but now I'm wondering, when would you actually need to see an orthodontist? Like, is having a crooked tooth just a cosmetic thing? Or could it actually, cause problems?
That's a great question, and it's one that we get a lot, actually. And while having a straighter smile is, a great perk, orthodontics really goes way beyond just the aesthetics.
Okay, so it's more than just a pretty smile.
Right. Remember how we were talking about how orthodontists are specialists in facial growth and jaw alignment?
Yeah.
Well, those things actually have a direct impact on your overall health.
Really? Okay, now you've got me intrigued. Tell me more.
All right, so, for example, did you know that a misaligned bite can actually affect how you chew your food?
No way.
Which can then potentially lead to digestive issues down the line.
Wow, I had no idea it could impact, digestion. I honestly always thought it was just about having a pretty smile.
Yeah, a lot of people think that. And a bad bite can also put strain on your jaw muscles, which can then lead to headaches, jaw pain, and even something called TMJ disorder, which can be really painful and really impact your daily life.
Oh, wow. Okay, well, now I'm thinking maybe I need to make an appointment with an orthodontist, just in case. This is way more than just cosmetic stuff.
It really is. And it even goes beyond just your physical health.
Oh.
Yeah. There have been studies that have shown that there's actually a really strong connection between a person's smile and their self-esteem.
Interesting.
Like, feeling good about your smile can actually boost your confidence and even have a positive impact on your social and professional life, too.
That makes sense. When you're confident in how your smile looks, you're not afraid to show it off.
Exactly.
Like when you're not afraid to smile, you just seem more approachable and friendly. It's really amazing how something as I don't know, simple as straight teeth can have such a big impact on our lives.
Yeah, it really is.
So let's say someone IS thinking about seeing an orthodontist.
Yeah.
Where do they even start? Do you need like a referral from your dentist? Or can you just go directly to an orthodontist yourself?
You know, it's always a good idea to start by talking with your dentist.
Okay.
They know your dental history, and they can really assess whether you'd actually benefit from seeing an orthodontist.
Right.
Plus, they can often give you a recommendation for someone they trust in your area. Think of them as like your own personal dental guide.
That's super helpful. Okay, so to loop back to our original question, orthodontist versus dentist, what is the difference? I think we've uncovered a lot more than we bargained for.
Me too. But I think the main takeaway here is that both dentists and orthodontists play such crucial roles in keeping your mouth healthy, but they're just different.
Yeah.
It's like two pieces of the same puzzle.
I like that.
Your dentist is like your general practitioner for your routine care. And your orthodontist is your specialist for those bite and alignment issues that, as we've learned, can have way more far-reaching effects than you might think.
You know, this deep dive has really been eye-opening for me. I'm realizing I've definitely taken my teeth for granted for way too long. It's fascinating how much is actually going on in there just to keep our smiles healthy and, functioning properly.
Right. And what's even cooler is that dentistry is always evolving. There are constantly new technologies and techniques being developed, which just means that there are going to be more comfortable and more precise treatment options available for people.
That's incredible. So for anyone out there listening who gets a little nervous before a dental or orthodontic appointment, just remember, these professionals are here to help you. They've dedicated years and years of their lives to learning how to keep your smile healthy and bright.
It's true, and never be afraid to ask questions. The more you know about your oral health, the more empowered you'll be to make good decisions.
Couldn't have said it better myself. All right, so I think we've officially demystified the world of dentists and orthodontists for today. Hopefully you're all feeling a bit more knowledgeable than you were before. And hey, maybe even a little bit more appreciative of those pearly whites.
And hopefully you're feeling a little curious, too. We've really just scratched the surface today. There's a whole other universe out there about how your teeth and your jaw and even your airways are all connected. Like, who knows, maybe a misaligned bite could be the reason behind that persistent snoring problem you've had?
You know, it's funny how we just kind of lump dentists and orthodontists together in our minds, right?
Yeah.
But they really do have such different specialties when you actually think about it.
That's true.
It's almost like comparing, I don't know, a chef to a baker. They both work with food, but their expertise takes them down completely different paths.
Totally. And I think that comparison really underscores why it's so important to have both general dentists and those specialized orthodontists all working together.
Like a dental dream team.
Yeah, exactly. Think about it this way. A dentist might be the one to first notice some early signs of bite problems during, like a routine checkup.
Okay.
And then they'd refer you to an orthodontist to take a closer look and come up with a treatment plan.
So it's really all about making sure that patients get the most well-rounded care possible.
Yeah,
right.
Exactly.
Teamwork makes the dream work. So this whole deep dive has really got me thinking differently about my teeth. Like, for example, the article mentioned a few other things that orthodontists handle beyond just traditional braces. Stuff like palate expansion. That sounds kind of intense, honestly. What does that even entail?
Yeah, so it sounds a lot more dramatic than it actually is. Basically, a palate expander is just a device that's used to help widen the upper jaw.
Right.
And it's often recommended for, like, children or teenagers if their palates are too narrow.
So it's basically like creating more space so that their adult teeth have room to grow in properly.
Yes, exactly. And doing that can actually have, like, a ripple effect on other things, too. Like, it can even help to improve breathing.
Whoa, seriously?
Yep. And it can reduce someone's risk of developing things like sleep apnea later in life. And it can even improve speech in some cases.
Wow, I had no idea all of that was connected. It really goes to show how interconnected everything is, like within our mouths. And what about those different types of bites that the article mentioned? Things like overbites, underbites, cross bites. What even are those?
Okay, so the easiest way to think about it is this. An ideal bite is kind of like a well-oiled machine, right? All of your teeth should fit together comfortably, and that allows you to chew your food efficiently and speak clearly. But when you have a misaligned bite, like an overbite, that's where the upper teeth protrude too far forward.
Okay.
Or an underbite, that's where the lower teeth stick out more.
Right.
Or a crossbite, which is when some of your upper teeth actually sit inside of your lower teeth when you bite down instead of on the outside. And those things can really throw the whole system off balance.
So it's not just about aesthetics then. It's really about how your teeth actually function together.
Exactly. And when your bite is off, it can lead to all sorts of other problems too, like difficulty chewing, jaw pain, headaches, even speech issues.
Wow, who knew teeth could be so complicated? Well, this has been a real eye-opener. I feel like we've learned so much about dentists and orthodontists and the importance of a healthy bite. Do you have any final thoughts for our listeners today before we wrap things up?
I think just remember, knowledge is power. Never be afraid to ask your dentist or orthodontist questions about your oral health, because really, the more you know, the better equipped you'll be to make those informed decisions about your smile.
Couldn't have said it better myself. So next time you're staring up at the bright light in the dentist chair, just remember this deep dive. Your dentist and your orthodontist are basically your partners in helping you maintain that healthy, confident smile. And that's definitely something worth smiling about.